Hello, my name is Dr. Marie-Claire Hughes and I am one of the partners at St Luke's. I joined in 2017 and I just wanted to explain to our patients and any other members of the public who follow our page what's happening over the next wee while. St Luke's has a long, proud tradition of serving the community of Crerluke. As many will remember fondly, St Luke's enjoyed a relatively stable team from the late 1980s until now. In the last 5 years, we have seen many valued members of our team retire. Although we always knew that those who started together would retire together, we could not have predicted that their well-earned farewell would coincide with a global pandemic and a national recruitment crisis in healthcare. Behind the scenes, we have worked hard to recruit new members to carry on the hard work. Unfortunately, with further retirements planned over the next 5 years, our already depleted team may shrink further. We are doing everything we can to increase our workforce and to use technology when appropriate to increase the number of patients we can safely manage. Without change and without patient support, there is a very real danger that practices will be unable to function safely and will have to close their doors for good. What can you do to help us to help you? We are asking that patients, number one, understand the immense pressure we are under. Every patient contact is reviewed by a doctor and triaged. Please remember that we are prioritising based on patient need. If you're not given an appointment as quickly as you would like, that's because we're accommodating somebody who needs to see us now. Number two, triage early so that we can prioritise the sickest patients first. Our appointments run out early and it can be difficult to manage people who wish to see us urgently but delay contacting us. Any late request should be of a sudden and urgent nature. This allows us to ensure that the appointment book is filled with those most in need and allows us to practice safely. Number three, please do not miss appointments. We're coming in early and going home late to sustain this service. Failing to show up for an appointment is wasting precious clinical time and depriving another patient of their review. Number four, please ensure that you are signed up to our texting service so that we can contact you via text. This saves you time and frees up our phones for those most in need. Number five, remember the practice is not always the best place to manage certain conditions. We may direct you elsewhere. Number six, remember that every member of our team is a real person. Verbal abuse and the anger we see on social media is soul destroying and often felt personally. Every member of our team are working hard to provide a safe service under conditions we couldn't have imagined a few years ago. If you're unhappy, provide feedback, but it's simple, but true. Be kind. Number seven, unfortunately the entire NHS is struggling and hospital appointments are frequently delayed or cancelled. We feel your frustration, but please don't take it out on our team. Number eight, we have never stopped providing face-to-face appointment. These appointments are taking longer, which is exacerbated by waiting room restrictions and cleaning protocols. For every face-to-face appointment we do, we can provide up to 4 phone calls or video consultations. With the current GP shortage, technology optimises our limited capacity. Remote consultations, be they via phone, video or photo, are not an easy or lazy option, but they allow us to manage a large number of patients safely. Number 9. The triage system works well, but we are struggling to manage our appointments around the large volume of triages arriving throughout the day. Closing triage at 1 p.m. allows us to dedicate GP time to dealing with triage safely. We will still be seeing patients until 6 p.m, but any requests for appointments received after 1 p.m. should really be medical emergencies as our book fills so quickly. Closing triage at an earlier time allows us to manage triage safely. This was the approach we applied to open access, and we see this as an online open access for modern times. The last 2 years have been challenging for practice and patients alike. We are doing everything we can to sustain a safe, patient-centred service. We are asking for your understanding and support with this. To those who have taken time to recognise the practice's hard work, thank you.